We'll be addressing brain drain and, of course, enhancing healthcare services, building on Governor Obaseki's health reforms in the state. Okay, now let's just let you know that Governor Obaseki's administration has made a very significant progress in healthcare reform, enhancing access to healthcare, primary healthcare through the Edo State Primary Healthcare Development Agency, and expanding health insurance with the Edo State Health Insurance Commission. Now, these initiatives have laid a foundation for Edo State as a growing healthcare hub in Nigeria. Yet the challenge of brain drain in the healthcare sector remains a pressing concern. It has been a pressing concern for a while. Now, of course, the administration prepares to take office, the new administration. Now, this program will help us examine the incoming government, how they can build on Obaseki's achievement to retain healthcare talent and improve healthcare delivery in Edo State. Our guest who is joining us virtually from the United Kingdom is Dr. Douglas Emeka Oko. He's a consultant neurosurgeon, a Nigerian healthcare reform advocate, and CEO of Ashanti Graham Medical Company Limited. Thank you so much, Dr. Douglas, for finding time to be on the program this morning.
Thank you very much, ITD Benin, and thank you, Daniel, for having me as well.
It's a pleasure to have you on board. Now, walk us through, how would you evaluate Governor Obaseki's contribution to the healthcare sector, particularly through the Edo HIS?
So the key thing, Daniel, here is that when you look at the governments at all levels in Nigeria, i.e. the federal government and the different state governments, generally, for the longest of time, even for the last 25 years since we've actually had democracy from 1999, none of them generally have really focused and prioritized healthcare in terms of funding and in terms of where their mind is. In Edo State specifically, it has not been different. So if you look at all the governments so far, none of them have really prioritized and really focused on healthcare and really put the funding and what healthcare actually needs in Edo State. The outgoing administration made some sort of attempt to try and create a foundation with, like what you talked about, Daniel, like the Health Insurance Commission and the Primary Healthcare Development Agency. They made some sort of attempt to create some sort of foundation. So the key thing, Daniel, is that the new government coming in next month in November has its work cut out for it when it comes to trying to try to move forward in terms of creating a healthcare system, especially a primary healthcare system that is fit for purpose and that really provides some healthcare, especially basic healthcare, to that last man, especially in the rural areas. Okay, so that's really, really important. So, summary, just some sort of attempt, created some sort of foundation, looking at the last administration, and then there's lots of work to do in terms of making that proper impact in the Edo State population.
Okay, talking about lots of work to be done and looking at some of the lacunas, do you think what this administration have achieved so far, do you think it have impact on the residents in the state?
So, Daniel, you use the word talking about some of the lacuna, and I'm saying the lacuna is not small; it is very large. Okay? And if you ask me, looking at the last administration, have they made a significant impact in terms of delivery, especially primary healthcare, to the citizens of Edo State? Remember, Daniel, the citizens of Edo State don't just reside in Benin City. They reside in, there are 18 local governments with 192 wards in Edo State. And a significant number of those people are in the rural population. And I'm saying that the impact is very minimal in terms of looking at the last. See, the key thing is not about actually coming on the media and giving some sort of figures and stuff. The population of Edo State is going up to 5 million. A significant number of these people are in the rural population. So when you ask the question about impact to that last man in the rural population, in those populations where you have farmers and stuff like that, if your question is there a significant impact to that last man in the rural area, I will say no. Even if there is, it's very minimal. And so again, like I said, Daniel, there's serious work to be done by the incoming administration.
All right, now talking about serious work to be done, in your view, what are the main factors driving brain drain in Edo State healthcare sector? Now, if you actually take a drive through some of the rural hospitals we have, you barely see medical doctors there. And even when you find hospitals, you don't even see health professionals. You don't see them available on ground. So what could be the factors driving brain drain in the Edo State healthcare system?
So, Daniel, the factors driving brain drain in the Edo State healthcare system are the same factors driving brain drain all over the country. Okay? But one of the things I always say is that most of our state governments are failing and failing really badly. You know, there's what they call the Sustainable Development Goals, Daniel. There are 17 of them. Number 1 is about poverty. Number 2 is about hunger. Guess what? Number 3 out of 17 is healthcare. Our governments, especially at state level and definitely at federal level, they have not prioritized healthcare. Okay, so in terms of when you talk about brain drain, every human being will vote with their feet and go to a place where they feel that they are appreciated and where they will get a good life. And so the question is, are healthcare professionals in Edo State or any other state around the country, are they getting a good life? Are they working in an environment that provides all they need to actually work? Are they getting proper training? Are they getting the kind of remuneration that will help them really look after their families and live good lives? Are they happy in their environment? Do they have the security that they actually need? Do they have the amenities, good roads, and all that they need? Now, these are the drivers of like the Japa syndrome that we talk about, where people actually live in Nigeria. Now, clearly, these are the same factors that are actually causing this brain drain and the healthcare professionals living in their very large numbers in different states and also in Edo State as well. So yes, these are the core reasons why you have healthcare professionals actually living Edo State like any other state in Nigeria.
Let's quickly look at the incoming administration. What areas should the new government focus on to improve healthcare system in the state?
Okay, so in the healthcare system has 6 components. There are 6 components of the healthcare system. The first one is governance and leadership. The second one is funding and finance. Third one is the human resource for health, the health workforce. Fourth one is service delivery itself. Okay. Fifth one is looking at things like medicines, vaccines, and medicine, vaccines, consumables that we need in healthcare. And then the sixth one is looking at what do you call it? Like using healthcare technologies to actually push things forward. Now, these components, the new incoming administration will need to clearly look at all these things. So when you look at leadership and governance, they need significant institutional reforms in terms of looking at the Ministry of Health and all the other agencies that are with them. The outgoing administration, they've actually done some work in terms of trying to digitalize most of these ministries, departments, and agencies, but there's still more work to be done. We need to make sure that we actually have very strong and robust regulatory framework within these ministries, departments, and agencies that will also regulate the healthcare professionals as well. Funding and finance, okay? We are still not getting up to that 15% mark in terms of how you actually deploy the resources, looking at the state budget to healthcare. It is still abysmal. And so again, the new government has its work cut out for it when it comes to that. We look at the healthcare workforce. You asked me the question about Japa, about people actually living the brain drain.
Yes, talking about brain drain, yes.
We need to really spend money, okay, on actually all the key things I've talked about, training, okay? And specifically in terms of the healthcare workforce, we need to actually focus on the healthcare workforce at the primary level of care, the basic level of care. We need to actually focus on that, really, really important. And maybe I'll talk a little bit about them as we go on and if we have time.
Okay.
In this discussion and this interview.
So
these are some of the things that the new incoming administration should really, really focus on, looking at these components of the healthcare system.
Okay, I hope we'll be able to manage our time, but if not, we'll of course have opportunity to bring you back on board again. But let's quickly move on. How have the Edohis, talking about the Edo health insurance system, how have it affected access and affordability of healthcare for citizens? Now, this outgoing government actually made it mandatory for every employer of labor to get all their everyone on their payroll access Edohis. But to an extent, the average Edolite on the street, how can they have access to this Edohis? What measures to be put in place?
So again, when you look at the health insurance scheme, is there any significant impact? What are the numbers in terms of the enrollees? Guess what? The numbers are just above the 260,000. And with a population of going up to 5 million, that is about 5% of the population. I don't want to use strong words, but when you talk of impact, that is going nowhere. And that is what I'm talking about, okay? I suspect very strongly that these over 260,000 people will be more in places like maybe Benin City, maybe Uromi, maybe Auchi. And I am saying that Edo State is more than that. We truly need the Edo State government, especially the new one coming in, to really understand that you have Edo citizens, Edo people, Edo residents in the rural areas, and a significant part of that population of 5 million people are there. And so this issue of saying, oh, employers of labor, enroll your people. How many people in Edo State are employed by the regular people that employ people in Edo State? And so we really need to go into the hinterlands, into the rural area when it comes to actually capturing the population and trying to actually enroll them within the Edo State Health Insurance Commission scheme. Granted, some work has been done. When you look at their website, for example, you can see that they actually update figures there. And so, again, some sort of foundation has been established, but there's more work to be done in terms of trying to actually pull more people into that system and also make sure that the system actually works. If you look at that system on their system, they say that they use like 351 hospitals, but guess what? Only about 27% of that are the primary healthcare centers. Do you understand? Just about 97 of them. But remember, we have 192 wards. And normally in a local government, you should be having roughly about 10 to 12 wards. So you can see that when in terms of impact, in terms of looking at how many of the Edo citizens have been captured by the health insurance scheme, we are still not there yet. It still looks like we're still playing to the gallery in Edo State. So there's serious work to be done, Daniel.
Okay. Now, as a healthcare reform advocate, and of course a professional that have practiced both in Nigeria and outside the shores of the country, now could you discuss the role of the Ministry of Health in improving hospital management and patient care, especially as the incoming government will be taking over the baton of leadership on the 12th of November. Remember, the governor-elect, Senator Monday Okpebholo, actually said that he's going to focus on primary health care, health delivery in one of his campaigns. So could you discuss the role of the Ministry of Health in improving hospital management?
So clearly, Daniel, the Ministry of Health is going to be the arrowhead in terms of deploying government policies, programs, interventions within the healthcare space. And the incoming governor stating that, oh, he's going to focus on primary healthcare, he is spot on. Now, we don't want a situation where it is just, just making statements and making proclamations. We want to see the work done. So the Ministry of Health, first of all, needs to actually get a commissioner of health that is relatively young, has a background in public health, understands that primary healthcare should be a fundamental issue. All the key components of the healthcare that I talked about, all the way from leadership and governance to funding and financing, the Ministry of Health must mainstream that, okay? And clearly, we must make sure that we truly focus on primary healthcare. We want at least each of the 192 wards to have a primary healthcare center that is truly functional, that has a proper building, has power, probably from solar, has water, has an area, a very nice area for people waiting and all that, has a proper environment, and that we truly start training the kind of healthcare workforce that can work in that area. Example, the community health extension workers, the pharmacy technicians, the medical lab technicians, and also incorporate the traditional better attendants as well, and actually make sure that you regulate all these people. And it is really key because the Edo State citizens, we need to actually have governments that truly focus on them for a very long time. Like I said, in the last 25 years of democracy in Nigeria, the Edo State governments, like other state governments, have not truly focused their energies, the resources on the people, and in this case, the Edo State people. And we want to actually see that happen. Daniel.
Beautiful submission there, Dr. Douglas. Let's move on now. How essential is healthcare funding and resource allocation in preventing brain drain among healthcare professionals?
So, the 2001, the Abuja Declaration, okay, all the African governments coming in Abuja and saying that they want to actually spend 15%, okay, of their budget in healthcare. Within the states, we need to start seeing that happen. We need to see slowly and incrementally them building up the amount of money, the funding that they actually put in healthcare in Edo State. remember, Daniel, you only put your resources to something that you think that is actually important. So one of the things I say, Daniel, is that we need to think right, act right, and spend right. We need a new philosophy in Edo State, especially when it comes to looking at the government. A philosophy that understands that healthcare is extremely important and that they will deploy those resources to healthcare. We know that when you talk about the human resource for health, it is a main pillar of how you actually deliver healthcare in a place. And so the issue of remuneration, of actually creating the proper environment for the healthcare workforce to actually work in, and understanding that you must create, in terms of looking at roads, in terms of looking at amenities, but not just the healthcare workers, but for the Edo State population in general, and start understanding that, please, okay, even we are looking at funding now, that primary healthcare is important and you must deploy a significant part of the resources. In fact, I would say almost 80% of the resources in healthcare should go to the rural areas. And please don't forget, new government coming in, that a significant number of your population actually stays in the rural area. And please deploy resources to all the key sectors, but specifically healthcare in the rural area.
Talking about deploying 80% of key resources in the healthcare system to the rural areas, I would like you to help us make sense of this, your submission. What incentives could the incoming administration provide to encourage healthcare workers to stay in Edo State, especially in the rural areas?
I'm going to give figures. So imagine, you actually have 34 state government hospitals that's supposed to be general hospitals. When you go to most of these general hospitals, you find out that you don't even have a doctor there. Sometimes they tell you that, oh, a doctor strolls in maybe once in a week. The truth is that most of those hospitals are not fit to be called general hospitals. So what we want is a situation where, for example, each of those general hospitals are actually as a reform to be maybe comprehensive healthcare centers that all the other primary healthcare centers in the world can actually link up to. And that particular doctor should be like a family physician, okay, who is well trained, who can do basic operations like cesarean sections, like appendectomies and stuff like that, and pay such a person very, very well. Make sure that you actually get like most of the primary healthcare workers, the community health extension workers from the local area, and make sure you pay them very well. Make sure that these people have light, they have data, they have water. Okay, so sink lots of funding into the primary healthcare spaces within the rural areas, and then you can actually keep people there. In fact, you do it in such a way that anybody staying in the rural area gets paid more than someone staying in Benin City, in Ekpoma or Ira. And of course, like I say, create that environment, and I've given some examples. This is a practical and pragmatic way to actually go, Daniel, in terms of actually deploying the funding in a strategic and an arrow point way by the new administration that's coming in November.
Okay, finally now, Dr. Douglas, we are running out of time, but we'd like you to quickly help us now. What role could public-private partnership play in strengthening Edo healthcare system?
So again, quickly, Daniel, you have lots of private entities, banks and others. One of the things they can do is what I call adopt a PHC center, adopt a primary healthcare center. We can have renovation and refurbishment, because we don't need to build any new thing. Okay, there are lots of buildings wasting away. Refurbishment and of a primary healthcare center in a local government in a ward by these banks, these primary, and it will be as their corporate social responsibility. That is one. Also, you have a very large Edo State diaspora within healthcare, okay? And those people can actually serve as volunteers and make investments within the primary healthcare space in Edo State. And those are just a few examples of how they have this public-private partnership, especially in the rural area.
We sincerely appreciate you, Dr. Douglas, for finding time to be with us on the program. We hope to have you more often on this platform.
Thank you, Daniel.